Hello, everyone. Welcome to the first episode of What's Up, Doc, a health and wellness show dedicated to guiding you, our audience, through the world of medicine and healthcare to help you live happier and better lives. I'm your host, Dr. Aalia Al-Barwani, and I'm a board certified family physician. My show, What's Up, Doc, is a production of Muslim Network TV, which is the only Muslim focused network broadcasting in North America. You can watch us 24/7 on Samsung Galaxy 19, Amazon Fire TV, Roku TV, and Apple TV. Muslim Network TV streams live almost every day, so please visit us on our YouTube page at youtube.com/Muslim Network TV and our website, muslimnetwork.tv, to tune into everything we do. Today on our first episode of What's Up, Doc, we'll be discussing important issues around COVID-19 and how it has been affecting our pediatric population. Here to join us in that discussion is Dr. Arunima Bera. Dr. Bera is board certified by the American Board of Pediatrics. She completed her fellowship in pediatric critical care at UCLA Mattel Children's Hospital in Los Angeles. Dr. Bera has also conducted research and presented on respiratory illnesses such as bronchiolitis and asthma in children. She currently works as a neonatal ICU pediatric hospitalist at Valley Children's Hospital in Madera, California. Welcome, Dr. Bera.
Thank you, Alia. Thank you so much for having me on the first episode of your show.
Absolutely. It's such a pleasure. We're so glad you could join us today. And, we are knee deep in COVID. We've kind of just been hearing a lot about it in the news, and we hear a lot of information about what's going on in the adult population, but we really don't hear too much about what's happening in our pediatric population. So we're really hoping that today you can help us shed some light on some of the trends that you're seeing in the pediatric population.
Absolutely. I really appreciate this opportunity to be able to talk about COVID in our children and the pediatric population. So, right off the bat, I will say that so far we are all quite fortunate to see that the incidence of COVID in children is much lower than that in adults. I promise you, this is the only part of our conversation today where I will mention a few statistics. Just bear with me. And today, most of the numbers that I will mention are from the CDC statistics, as well as the weekly reports that the American Academy of Pediatrics publishes, and these are all publicly available for anyone to have access to. So, in terms of just numbers, to date, we have recorded over 1 million cases of COVID that have been, proven positive cases of COVID in children. And, just as a comparison, this is only about 10 to 11.5% of all cases that have been positive, both adults and in children. So it's a fraction of all cases. In terms of, the overall positivity rate, it's really 1380 in about 1.3%. So again, this is quite a small number so far. Having said that, when I was looking at these weekly reports of cases being reported across all states, this is we are seeing an increase of cases as well as hospitalization that are related to COVID in children in some states with every passing week. So there has been about a 22% increase in cases in children. And these are just cases that are, positive PCR swabs in children. That is something that we are being very mindful about. We are watching very closely, since you know that as you have an increase in positivity of cases, subsequently you may also have an increase in the hospitalization rate, as well as the morbidity and mortality of COVID in children. So overall, just to sort of sum it up, we are not seeing as many cases in children as we are seeing in adults, but there is definitely a slightly increasing trend of COVID in children, and so that's just something be very mindful about.
That's really interesting to hear. The numbers are certainly overwhelming, and the fact that they continue to increase is even more just frightening, really, across the board for pediatrics and adults. What do you think? If you can speak on this, what do you think is the main difference, if we have figured out what is the main difference in how and why kids are being less susceptible, or are found to be less susceptible than adults?
Yeah, that's an interesting question, and it's not a very easy question to answer because, just as you alluded, this is something that we are closely looking at, and we're still examining the reasons as to why children are either not as susceptible or the severity of infection is not as much in them as in adults. Um, there have been some, theories as far as, children coronavirus infection and viral infections are something that infants and toddlers frequently do experience as they're growing older, and so whether or not there is some level of cross immunity that they might have. But again, this is not something that is proven, so I wouldn't like to be playing a lot of speculation. What I would say is that, in terms of numbers, even though we don't see as many cases of COVID in children as we do in adults. Uh, COVID is definitely still a problem in children in pediatrics. And once they are testing positive, once they do have viral infection, even though it's a fraction, some of them can have significant infection from them. So it is definitely something that is to be taken seriously for our kids, especially for our newborns that have, immature immune systems. It's and as well as for children that may have other underlying medical conditions that would definitely put them at a higher risk as well from having a significant infection. So
Interesting. I mean, you brought up a lot of points there that I would love to follow up on. And when you talk about being tested and things like that, as for parents or people who are around children, what are the symptoms that we should be looking for to go and get our child tested? Just, are they the same as what we expect in adults? Just, can you touch on that a little bit?
absolutely, that's a very good question. So the most common symptoms of suspected COVID-19 infection that I would have parents be mindful of are fever, a runny nose, and cough. So these are some of the most common symptoms that we
Mhm.
see. Of course, there are some other signs and symptoms to also be mindful of. So you can also see things like just extreme fatigue,
Mhm.
myalgias, which is just a scientific way of describing body aches, or just overall soreness that we feel
Mhm.
with a flu-like illness. Um, in children that can communicate with you, they may also report loss of taste and smell. We have seen that in children
Okay.
as well. Mhm.
That's
As well
interesting.
as
Sorry to interrupt. So, what if it's just a fever, or if it's just one symptom and not the other? Are we looking for a specific combo, or if someone's just tired, when just a little bit of guidance as far as what do we always want to look for, as far as along with something else, if that makes sense.
absolutely. So it doesn't have to be like a set list of symptoms
Okay.
that the parents have to wait to see in their children. It could be a fever, but if it's a fever that's unrelenting, or
Mhm.
that's high fever and it's not really resolving with giving Tylenol or ibuprofen, that is something to look out for. Or if your child has difficulty breathing, so that's another really thing that you should perhaps not wait
Mhm.
too much to take the next
Yeah.
steps for.
Yes.
Things like abdominal pain as well as diarrhea. So some of these other symptoms as well are overall just part of this whole viral syndrome that can also manifest.
Okay. I feel like that's, there are so many symptoms there that overlap with other things, like you mentioned, viral illnesses, and we're heading into the flu season. That as a for parents who want to know how they should manage, let's say, how important is it to be tested versus managing care at home, I guess is what I'm trying to get at, because with flu season coming, these symptoms may easily be confused, and with allergy season, right, as allergies or a cold or something like that. And so do you have some kind of guidance on when to make sure you do get testing, when to manage at home, when to seek help, that kind of stuff?
Yes, that's also a great question. And, I will say that testing is very important, right? Because testing is information. It's information for the parents, it's information for the provider, and it's information for the community uh, to be cognizant of the rate of spread. Having said that, I would really advise all parents to first call their pediatrician and report what symptoms they are seeing in their children. So, for example, the CDC, if you look at the CDC website, they have some very clear-cut guidelines. But essentially, if your child or if your infant has a fever, and typically a fever is strictly 100.4 Fahrenheit and above. But I would say anything above 100 Fahrenheit, if they either have a fever or any other symptoms, and if they have either been in close proximity with someone who either has COVID or suspected to have COVID, or if they're in a community where the overall incidence of COVID is pretty high, which unfortunately is the case in many
Everywhere. Yes.
pretty much. I would advise that the parent call the pediatrician's office first
Mhm.
and see if there is a way to get either that evaluation or testing done in a remote and safe way. And the reason I mention that is because, you know, this is an interesting dilemma, right? Where you do absolutely need to get the care you need for your child, but you also want to prevent either exposing others or exposing yourself further in that waiting room in the doctor's office. So, unless, of course, it's a emergency or an urgent situation where you really feel like your child is not breathing comfortably or if they're not as responsive, then I would, absolutely don't wait. If you need to call your doctor right away or even take them to the ER, please do that. But if you feel like if your child has a fever, he or she is not quite acting right, or if he has any of the other symptoms, then absolutely call your pediatrician, get all the options available for testing, and you can always refer to a provider as well for further
So
advice.
that's a lot of valuable information there. So just to recap, what I heard is, we want to make sure that we take the symptoms in context to possible exposure. So that's an important thing. And as you mentioned, as numbers are rising everywhere, community exposure is now very common everywhere. So it's kind of hard to keep that in mind. It's more direct exposure, from what I understand. And then when going to get tested, also keeping in mind, if you didn't walk in with it, you don't want to leave with it. And so that's a good point. There are some places that are offering COVID testing in an outdoor situation, like you can kind of drive through in a car, or you can, kind of like drive-bys really. And would you recommend something like that over going into and sitting in a doctor's office with other patients in a closed environment?
Yeah, I think a lot of it just depends on the sort of initial evaluation of how sick the child, seems like. So, of course, there are certain situations where you have to have, you as the provider, you have to evaluate the patient in person to see if
Yes.
whether or not they're sick to be even evaluated in the ER. In which case, again, don't wait. Talk to your doctor, come to the clinic. But if it's a fever, runny nose, and cough, congestion, which otherwise, your child is okay, then I think a drive-by test is testing facility, or your own clinic or office may also have other options of testing that they may send over to you so that you can spare that trip for yourself and for them. So I would definitely encourage parents to look into that as well.
That's really important. So continuing, making sure you continue to stay in contact with your pediatrician, that's really important, of course. And how do you feel about guidance over the phone? People are just so scared now to go to places in person. Some offices might offer a virtual visit or even a phone visit. Do you think that that's something parents should maybe think about before walking into their pediatrician's office?
Absolutely. I think, televisits are really now sort of the new normal, right? That's how a lot of providers are seeing their patients. And it's in many ways, it's a safe way and it's effective too, because you do get a lot of information, even though it's virtually through a screen. So I would definitely recommend parents to reach out to their providers either through phone or through televisits. And providers may also be able to sort of triage a lot of visits depending on how significant they might think a patient or how ill a patient may be. So yes, absolutely. Please
Good.
consider
That's really good to know. You mentioned a number of times, and I want to stress that it's if your child is having um, difficulty breathing or other alarming symptoms that you are concerned about, always make sure that you are rushing to the emergency room and not waiting for a virtual visit. Or right? Okay.
yes, absolutely.
Good. Now, one thing that we've been hearing a little bit more about, or I have at least on TV and on radio, is with respect to MISC or multi-system inflammatory syndrome in children. And so, tell us a little bit about that and how it relates to COVID.
Yes. So MISC, as you just said, it's a multi-inflammatory syndrome in children. It's something that we have started to see in children that is sort of a later manifestation after the initial COVID-19 infection. So as the name suggests, it's what my understanding of it is that it's this exaggerated inflammatory syndrome that we are seeing in some children. And it's the manifestation of this is usually seen as high fevers, a overall body rash, your child's eyes may be bloodshot, so what we call as conjunctivitis. Their hands and feet may be swollen, and it might also affect a couple of organs in the body. So we've seen a lot of cases of the heart function potentially being affected. So if your child is complaining of chest pains that are again unrelenting, that they don't really go away, then that may be a sign. Their lungs may be affected, their kidneys, their liver. So it's this multi-inflammatory syndrome. Again, I would like to emphasize that it's still a rare complication of all the COVID cases that we see in children, but it's definitely on the more severe and serious side of the infection.
That's important to understand. I think most of us are taking COVID seriously and the complications, especially in our children. But just like we talked about some warning signs earlier, this just kind of adds to that chest pain, along with the trouble breathing. Just making sure that even if you've been diagnosed with COVID, if things are taking a nosedive and are becoming worse, definitely don't sit around and wait, hoping it will get better. Definitely seek help as soon as possible. Very, very important.
Yes, absolutely. The one thing, thank you for actually reminding me to mention that these symptoms or this whole syndrome may actually pan out within days or even weeks after that initial COVID infection. That, by the time they present to the hospital, they
Mm.
may or they may not even turn positive for COVID. So
Wow.
this is something that is a little bit later in the course. So yes, absolutely. My advice and recommendation would be to really keep an eye if your child is having further symptoms or signs of them having significant abdominal pain or them not being quite as responsive to you or if it's a baby, the baby is inconsolable and not easily consoled, then that may be just something to keep in mind.
Well, thank you. That's been really helpful. I think that will help a lot of parents to know kind of how to maneuver and move forward if they do have a child with COVID. Let's take a quick break now, and we'll be back in a few minutes, but please stay tuned to What's Up Doc and Muslim Network TV. We'll be right back.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. Past campaigns covered a wide range of humanitarian concerns. Through Bosnia Task Force, imams and leaders of Chicago's Muslim community worked to ensure Bosnia became a top national issue. This led to life-saving American policies in Bosnia. A key accomplishment was helping to get rape declared a war crime. Initiatives also included Kosovo Task Force, Central African Republic Task Force, and Flint Coalition, which brought awareness to the water crisis affecting the people of Flint, Michigan. Highlights of our work include supporting Black Lives Matter, Parliament of the World Religions, addressing climate change.
So wasteful consumption starts the ruthless production, and that's where we need all the fossil fuel in the world.
And prominent media exposure.
This is Imam Malik Mujahid, President of Justice for All.
And I'm the Director of Outreach for Justice for All.
And that's why we need to go back to what worked.
Today we're demanding an apology from the CEO of Costco.
The Chinese crackdown on Uyghurs and other Turkic people has only gotten worse.
Current programs such as Burma Task Force advocate for the rights of Rohingya refugees in Bangladesh, internally displaced populations, and all those denied freedom of movement and at risk of starvation. Through this, we mobilized thousands of calls to elected representatives. This paved the way for the U.S. to increase funding for Rohingya refugees from $30 million to over $600 million. 2 of our documentaries were featured on international news outlets. The Rohingya People, A Slow-Burning Genocide on BBC World News, and Rohingya Refugees Tell of Massacre was featured on CNN. We've organized rallies, UN mission visits, expanded presentations on campuses, promoted research and report writing, outreach to think tanks, media, and other influencers. Faith Coalition educates about the Rohingya genocide and crimes against humanity faced by ethnic groups in Burma. We've traveled to refugee camps, convened a meeting of Karen, Kachin, and Rohingya leaders, both to encourage cooperation and to guide them in congressional outreach. We organized Rohingya Advocacy Day. This led to over 100 participants visiting the offices of 60 U.S. senators and congressional representatives. Free Kashmir advocates for the people of Kashmir. Long-term goals include the call for self-determination, the end of the Indian military's occupation of the territory, and raising awareness of Kashmiri issues among the American people. After the August 5th reinvasion of Kashmir, we organized national protests in front of various Indian government buildings, partnered with Stand with Kashmir, and launched a petition condemning the Gates Foundation's decision to present Prime Minister Modi a humanitarian award. Save Uyghur informs Muslims and neighbors of other faiths about the ongoing cultural genocide of Uyghur Muslims and mobilizes public support. Our projects include boycotting Chinese products with our Fast from China campaign, pushing Bill S-178 in the Senate, and organizing a nationwide protest of Costco. Together, we can continue to stand up for justice. Justice for all.
Welcome back to What's Up Doc on Muslim Network TV. I'm your host, Dr. Aalia Al-Barwani, and I'm joined today by Dr. Bera, who's teaching us about the effects of COVID-19 in the pediatric population. So before the break, we were just discussing some of the symptoms and complications that we tend to see in our pediatric population, and we got some advice from Dr. Bera on when to seek help. So definitely any alarming symptoms we talked about, we want to make sure that we're getting help for that. Earlier, Dr. Bera, you mentioned to us about children having higher risk, certain children having higher risk of complications, even though the incidence is lower in our kids. There can still be complications. We mentioned MIS-C. Now, what would you say for kids are risk factors that put them at risk for these complications?
Yes. So I will say that, although in, again, majority of cases, COVID-19 may manifest as a viral infection that is overall self-limited, although again, the potential for it to be a significant infection might still be there. There definitely is a subset of children that may be at increased risk from a more severe form of illness. And so, some of those patients would be your immunocompromised patients. So, either from cancers or from other conditions that may weaken their immune system. If they've been on chronic steroids for anything, that would be another, subset of patients, as well as patients that have underlying heart disease. Mm-hmm. So if they have congenital heart conditions for which they needed surgery, that would be one subset of patients. And I would also like to mention patients who have underlying lung conditions. So conditions such as prematurity, so if they were born premature, conditions like asthma, or again, any other autoimmune condition that affects their lungs as well. Those children, I would, just be more mindful of just watching them even closer, because we have unfortunately seen that they do tend to be hospitalized, due to COVID, and sometimes have, more severe infections.
Absolutely. It sounds like there are quite a few parallels with respect to, when we think about who are higher risk. I mean, our adult population, similarly, lung disease, heart disease, immunocompromised. So it's not too different, it seems, in our pediatric population.
Yes, absolutely. You're right about that.
Mm-hmm. So we've kind of focused a lot on, what are we seeing? What are we worried about? What signs, what things we need to look for? Let's talk a little bit about how can we keep our kids safe? What are the things, I know we've heard a lot from the CDC about the importance of wearing a mask, washing our hands. Again, that information is not specific, or what is put out in the media isn't always specific for our children as well. So just if you can talk a little bit about where, how that affects our children. Should we be doing the same? Is there something more we should be doing? I'd love to hear about that.
Yes, absolutely. So, you've probably heard multiple times on the news, and I am also going to echo the same statement, and that is prevention is always, always better than having to, deal with the consequences of the infection. And as much as you can, if you have it within your power and control to prevent yourself from getting infected, that is always better, right? I would maintain that the public health recommendations and the public health safety measures that are recommended to everyone in terms of keeping 6 feet distance from everyone, frequent hand washing, having a face cloth mask or a regular mask over your face when you're going outside. Those still apply to children as well as to teenagers and young adults as well. So I wouldn't really take much away from that message. Of course, when it comes to younger infants and toddlers, if they can be kept indoors and in a relatively insulated environment from either other people visiting the household, from other children visiting the household, because the rate of the kind of spread of COVID amongst children can be relatively very easy as
Of
well.
course.
So keeping that in mind would be really, really important. I always tell my parents when there's a newborn in the hospital and when there's parents that as much as I know grandma wants to come and visit and kiss the baby, that I really recommend, especially right now, for other friends or extended family members to not be visiting the house, and to protect their children as much as possible. And yeah, just it's not easy. I'm not going to pretend that having maintaining that kind of distance amongst children is a very easy task, because it's the most natural thing for them to interact with everyone and to engage. And I mean, that's how they learn about their environment. But as parents and as adults, we just have to do our bit to try to be as consistent as we can.
Of course. One of the things that I've noticed is as a challenge for my friends who are parents is getting their children to keep masks on. Even if it's the right size, they usually don't want to keep it on. And so I've seen where they just kind of give up and maybe have them just wear a shield. Do you think that that would be helpful if they're not able to keep a mask on a toddler?
Yeah, certainly. I mean, I feel like uh, that's another option, and sometimes it is what it is. If it's a 2 or 3 year old and they're super rambunctious and they don't want to keep it on, then a mask is definitely an option. I will say though that if you are in a relatively well ventilated area outdoors where you don't have a ton of people around and your child is sort of running around and playing about, as long as it's not for a very prolonged amount of time, it's probably okay for them. Again, as long as it's a well ventilated outdoor space, then I think it's fine. But as much as possible, I mean, first of all, limiting their exposure to outdoors, to going to grocery stores or restaurants. I mean, most of them are being severely restricted anyways.
Yes.
But that would be the very first step to limit their exposure to outside. And if you do have to take them outside, because sometimes you may have no choice, then face shield is definitely an option. I will say though, be a little bit mindful that face shields are on very young infants and children to not be totally occluding their nose and their face, so keeping at least some level of spacing between the mask and their face, just because just to make sure that they're comfortable and they're able to breathe okay. So yeah.
That's an important point. It can be also kind of scary, I think, for kids to have to put something over their faces. It probably helps somewhat if the parent is also wearing something. Then a lot of times kids want to copy what the parents are doing. So I can see where that would be helpful. So parents, make sure you are also wearing a mask or a face shield.
Absolutely, and you could even make it a game for your child. Like, I can wear like a Batman mask, and my kid can wear like a Spider-Man mask. Like, make it a game. Make it something that's fun for them to interact with, because they really don't know what's going on. They're just scared and just wondering what is this weird thing that everyone's wearing. So I think if you be a little bit creative with it, then perhaps it will help them.
Absolutely. You mentioned as well with respect to getting. I think you had mentioned something about vaccines or flu season is what we were talking about, and so would you suggest that with respect to keeping safe, in addition to the things we've talked about, what's your stance or what do you think about the flu vaccine?
Thank you for mentioning that. I have to say, I'm sure everyone's looking at the news, and it's very encouraging to see that these COVID vaccines that are coming out thus far have, pretty good efficacy. But when I looked into the studies that they did, they didn't really include children in these trials, as far as I know. So while I can't really comment on whether or not they will be 100% effective and safe for children. And I think in subsequent trials, they are going to start including children in them. What's the one shot that's available already that we can all take, and we can also have our children and infants take, and that is the flu shot.
Yeah.
The animal flu shot is definitely there for you to, get your kid vaccinated, and it's an important one to do so, right? Because COVID or not, flu is always around, and we are well within respiratory season now, where we are seeing, some children come to the ER with, viral symptoms, whether or not it's COVID. So that's definitely one thing you can protect yourself against, and it's right there, and we know that it's safe.
Exactly. It's tried and tested. We've had a flu shot available every year for decades. And I want to kind of touch on what you said earlier about our patients who are at high risk of complications, the ones with heart issues or lung issues, including asthma. I mean, I'm sure you know more than anyone how important it is to get a flu shot outside of COVID-19 with our susceptible populations.
Absolutely. I think for those, populations, I will say with some immunocompromised patients, they have to be a little careful. So again, always refer to your primary care provider and to the subspecialist to see whether or not, getting a vaccine is safe for you. But in general, if it's a child with asthma, it is of paramount importance for them to, be up to date with their shots. My own sister has asthma, and so I always make sure that she is up to date with all her shots, and as much as she can, she's keeping herself safe.
Good. That's. I'm glad to hear that. I'm sure she's very happy to have her personal her personal doctor. Now, as far as what you're experiencing in the hospital, I know that you work with the neonatal team, and so you're dealing with newborns and you're seeing what's going on in the hospitals. I'm really curious to hear about what the experience has been like for mothers, new mothers, or maybe second time, third time mothers who are having to deliver babies in the time of COVID, where they may not be able to have as much contact, and there's more precaution around how they can handle their baby. I would love to hear a little bit about what it's like during these times.
Yes. So, this is really a very interesting situation that we found ourselves all collectively as part of the healthcare team as well as the families. I will say that, we've had a fair share of mothers who have delivered their babies when they themselves have either tested positive for COVID during the time that they're about to deliver, or they had a history of COVID in the past, and they're either still testing positive even though they may or may not have symptoms. So it's really something that we've had to, as pediatricians and pediatric hospitalists, we've had to be very careful about not only taking care of our patient, which is the newborn, but also taking care of the mother. And Alia, just as you're a family medicine physician, so I'm sure you know that we're not just taking care of that one patient, we're taking care of the whole family as pediatricians as well. So I will say that it's in the beginning, it felt a bit challenging, but we do have some guidelines that have come out from both CDC as well as AAP, the American Academy of Pediatrics, that essentially allow us to take care of the newborn and to allow the newborn and mother to, bond with each other, for the newborn to be able to get all the benefits from, in terms of breastfeeding and all of those things in a safe way, so that they are able to, grow and develop well, but at the same time, it's done so in a safe manner. Mm.
Absolutely. I mean, that's good to hear, a lot of the benefits of, skin to skin and being able to breastfeed as a mother. It's good to hear that those are not falling by the wayside, and it's something that is still within new restrictions and guidelines were, still being implemented in the hospitals. And so that's comforting to hear that, with everything going on, we're adapting and adjusting and trying to still maintain the things that we know are beneficial to mother and baby. Yeah.
Yes, absolutely. So in some of the preliminary studies that have come out, they have shown that overall breastfeeding, even with a mom who is COVID positive, is safe, and that it is not contraindicated. It is not something that we should stop a newborn from getting just because mom is positive, just because of the numerous benefits that breastfeeding comes with. It boosts immunity. It has some very, very essential immunoglobulins, and those are protective antibodies for the newborn. It has essential, fats and proteins and nutrition for the newborn as well. And we've also seen that the rate of transmission of COVID via breastfeeding is fairly low. That's what we're seeing so far. So yes, certainly in our hospital, we're a very baby-friendly hospital. So we always encourage moms, whether or not they have COVID, to always breastfeed. And we also encourage skin-to-skin contact. So that's basically within the first, hour of the baby being born, we have, baby have direct contact with the mother. And again, that really helps and facilitates in maternal bonding with the newborn. What I will always emphasize, though, whenever I am talking to a mom who has COVID, who's been tested positive, to always wear a mask when she is feeding or she's handling her newborn in any way. And certainly if there's anyone else in the room, they should always have a mask on themselves as well. If mom decides to, express her breast milk, and then feed it to her newborn, I also encourage, when they eventually go home, to frequently disinfect, the equipment and the pumps, pretty much like, in other situations as well, maybe just to take it, an extra step. But yeah, those are certainly things that we don't, discourage, unless of course mom is really symptomatic to the point that we feel like the benefit of having too much of skin to skin is sort of outweigh. It's not as much as the risk of possible direct transmission of COVID to the newborn. And if we do have a situation where, we feel like mom is having either high fevers or she's really symptomatic with COVID, then there are some selective cases where we will transiently separate the newborn and put them in what we call an isolate, just for some time, so that at least some of the transmission can be prevented that way.
That's really valuable advice. Thank you for that, Dr. Bera. We're going to continue this discussion in just a few minutes, but first we're going to take a quick break. You're watching What's Up, Doc on Muslim Network TV. We'll be back after a few minutes.
Assalamu alaikum. My name is Adam. You remember me? I appeared in so many episodes that Sound Vision has put on the market. No matter what. Hey, what's happening? Hey, oh, sorry. Lockdown is what it is. Well, continuing here. In this lockdown, Sound Vision never stops thinking about you, the viewer. We'll have to get back into production again, online and inline. Everybody in their own space, even me. Although I'm stuck with Lanisa.
Salam! Salam! Salam!
I know, you were shocked too. Well, let me continue. This is what I was going to say. Salam! 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 Cut! Finally, I get my own screen time again. Thank God. And so we invested in new equipment to bring you even better production with new songs and new singers and animations. Well, here are a few clips. And Sound Vision has brought all this into your home, making Islamic values and teachings easy. And if you know me, Adam, a multi-talented actor, well, sometimes I'm an actor and the reporter and the... Oh, that's enough. Let's move on to the next section. Well, you can watch these new episodes on our new app at www.adamsworldapp.com. We have previews happening every day on Muslim Network TV. Sound Vision has been serving generations, moving and changing with the times. We are all faithfully connected. That is a huge blessing. Your donation helps keep these programs available now and into the future. We take this job of helping tomorrow's Muslims today seriously, and you should too. Today, we need your help. Children absorb and learn from everything they encounter. Make that wholesome, positive, grounded in our faith. Together, we can accomplish our goal of raising better Muslims, better neighbors, and better citizens. Please donate generously. It's an investment in our future. But to finish, let me tell you, there are new scripts of my new mission. And it is something that I enjoy talking about. My new mission is space. Houston, we do not have a problem. Salam, see you soon.
Welcome back to What's Up Doc on Muslim Network TV. I'm your host, Dr. Aalia Al-Barwani, and I'm joined today by Dr. Arunima Bera, and we've been talking about COVID-19 in our pediatric population. Before the break, we were talking about what it looks like in the newborn, with newborn care in the hospital. And I found it very interesting that you were saying that everything is kind of trying to maintain that mother-baby bond, and the importance of wearing a face mask for the mothers, in the initial periods. And so I thought that was really interesting. I wanted to just dovetail on that real quick and ask, for what period of time do you usually have mothers kind of keep that mask with respect to caring for their babies?
Yes. So I ask mothers to definitely keep the mask on for as long as they breastfeed the baby and for any period of time that they're bonding with the baby. So if they are, having the baby on them, on their chest, or, if they're changing the baby, really any kind of handling around the newborn, because it's more so the proximity that they have with the newborn. So at least while in the hospital, I do encourage that. And I also encourage that they maintain the same practice when they go home, at least for about a week until, we know that theoretically their rate of being in the chances of them being infectious will decrease, after some time. So.
Okay, well that's fair. I think that it's definitely going to help reduce the transmission to the baby, as you had mentioned, and we want to make sure that happens. I want to switch gears a little bit and talk about, the psychological effect in your experience that you might have seen with respect to how COVID-19 is affecting children. You had said earlier with respect to kind of getting kids to wear masks. A lot of the times they don't know what's happening, and it can be a confusing time for them. Why do I suddenly have to wear this on my face? And so I would love to hear a little bit more about your experience with that.
Yes, I mean, that's a really important question. And, when we look at sort of the psychological impact that this pandemic has had just overall on adults, on children, it's not often the first thing that we look at or we talk about, because sometimes it doesn't feel as tangible as, some of the other outcomes like rate of hospitalizations or deaths from COVID. But it's definitely a very, very real thing. And, I'm sure you all know that the rate of burnout and, essential workers that are on the front lines, collectively, they're all feeling very, very exhausted, physically exhausted, mentally exhausted. And, when it comes to children, if you think about it, their sense of reality and also their sense of what used to be a normal routine and normalcy has pretty much been disrupted. For the most part, most children are not going to schools anymore. They're not seeing their peers. They're not seeing their friends. They're not really getting to interact with, their family or friends in the way that they used to. So I think it brings about not only confusion, but a lot of anxiety too. I've read about a couple of studies that are going to start looking into this, not only now, but also in the long term. Because it would be interesting to see sort of what the long-term psychological impact would be as well. I did read that there was a study that came out of Wuhan, so in China, where the initial lockdown was held, where they did report an increase in anxiety and depression amongst children and teenagers during that time. Which, unfortunately, that does make sense as to why that would be.
Yes. I mean, we're seeing, not to interrupt you, but we're seeing, that reflected in the adult population as well. And we're all going through this together. So like you said, it's not surprising that we are seeing an increased rate in our kids as well. Absolutely.
Absolutely. And, I also want to take this moment to just acknowledge what adults and especially parents are having to go through. They have to juggle between the role of a working professional and an educator and a parent all in one. I mean, that really is, it's an incredible amount of responsibility and stress. So to all the parents that may be watching this, I want to give all of you a applause for doing the best that you can. And, as a pediatrician and as someone who's always an advocate for children, I definitely appreciate all the work that, you are putting through. And I would encourage that, at the end of the day, this pandemic may not, be over yet. And you may feel overwhelmed when you watch the news and you see all the numbers, but just take a moment and check in with yourself, and after that, take a moment and check in with your child. just see what's going on in their minds. How are they coping? How are they dealing with, with all that is going on? Because they may not always be upfront and expressive with you. They may have other ways of, showing their frustration or, their confusion. So
Maybe
I think
acting out or changes in their behavior that they used to be social, now they're withdrawn. That's a good point. That's a really good point. So definitely keeping an eye on your child's behavior and understanding that everyone's mental health, including your child, is being affected by this. That's a really great point, Dr. Bera. And with that, I think we'll just we'll wrap up our first episode. Thank you so much, Dr. Bera. Really enjoyed our discussion on COVID-19 in our pediatric population. I really appreciate you taking the time to join us and share this valuable information today.
Thank you so much. It's always a pleasure, and it was great having this conversation with you.
Thank you. I wish you luck in your career for sure.
Thank you. You too.
So thank you everyone for joining us in our first episode of What's Up Doc. You can watch this episode not only on our YouTube channel, but also on our website, muslimnetwork.tv. I'm your host, Dr. Aalia Al-Barwani, and I had the pleasure of discussing this important topic with Dr. Arunima Bera,